Hi, are you having hip pain or is it really coming from your back?
We have 3 tests to help you find out.
Bob and Brad, the 2 most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course,
All right,
Bob.
Brad, as we already mentioned, we're going to talk about hip pain. A lot of people are having hip pain, but it may be coming from your back. We're going to help you try to work through this puzzle.
Right.
And it's difficult to do. Therapists struggle with this, doctors struggle with this.
Right. How many times have you had someone come in with a hip diagnosis and you end up treating their back and take care of it?
Right, and we've also, worse than that, I've seen people who've got cortisone shots in their hip and it didn't get any better, and then we found out it was coming from their back.
Right.
So we're not, you're not therapists, and therapists struggle with this, but we're going to show you 3 tests that'll help you maybe narrow it down.
Right.
The problem is hip pain and back pain can share the same spots.
The symptoms present almost identical
Yeah.
in some cases.
Yep, hip pain can be here, it can be here, it can be here. A lot of people think their knee, but they can have knee pain, and it's actually from their hip.
Right. They get the hip replaced and it's all taken
Right,
care
all
of.
goes away. Same with back pain. It can be here, it can be here, it can be here, it can
Right.
be here. So they share a lot of similarities.
So we're going to try to give you some rules of thumb that they usually do not share or you can separate.
Right. First one, generally, if it's worse with sitting, we're thinking more of the back.
Right.
Especially if you sit and maybe do some repeated flexion like this, and it gets worse, I'm thinking more back. Aren't you,
Right.
Brad?
Usually, yep.
Yep. All right, the second thing, Brad, do you want to show this one, prone extension?
Sure.
While you're doing that, you go ahead and talk. I'm going to get a cane.
Okay, so if you just lay down on your back and say the pain resolves and it feels relatively good here, and then you do a couple press-ups like this, and the pain changes or the pain from your leg goes up toward your back and it centralizes, we call, there's a good chance it's more in your back and not in your hip, okay? Because we're not doing anything with the hip, but we are adjusting the
We're
back.
extending the hip a little bit, but
A little bit, yeah.
yeah, I just generally, if it, like Brad said, if it narrows up the pain or centralizes, that's really a good sign, and that means it's probably from your back. Or if it-
Right.
like you said, if it alters it at all. The third sign, Brad, is if you want to take a cane, if you walk and it actually gets better, then it probably is more likely back pain.
Yeah.
If it gets worse, it is more likely hip pain. If you walk and use a cane and it gets better, I'm thinking more likely it's hip pain.
Sure.
That all makes sense?
Yep. But yeah, and again, these are
General
It can
rules.
shift back and forth, and this is tricky.
Because I've seen back pain that has gotten better with a cane.
Yeah.
But generally, as a rule of thumb, and generally you're going to want to use the cane on the opposite side, by the way.
Right.
Brad.
If
Brad
this, the sore hip is here, I'm using the cane here.
All right, one last bonus test that they could do, Brad.
Yep.
What we do is we look at is how much motion does your hip have? Let's say you're having the pain on the right side, and you cross your leg over, and that hip stays way up here. It doesn't come down like that.
Sure.
Where this one comes way down. You compare the 2 sides. And
Right.
if one has a lot less motion, there's a good chance there's some pretty good arthritis in there, or something's going on to block
Right.
the motion and giving you pain.
And usually the side that has less range of motion, the one that comes up to here and you push it down, is probably going to be a little painful
Right.
in that spot.
You want to show that thing that you were doing, Brad?
Sure. Like if you're wondering, you got the pain here, and if you're sitting and you put your leg out, and this is the only motion you can do is rotate your foot back and forth, and that increases the pain right in the hip. It's probably the hip because my back is not moving at all, but I'm moving just the hip joint, isolating that position. Then it's probably more that direction.
And to mix it up even more, Brad, the possibility is there that you could have both, hip and back pain. So,
Yeah,
all right. But that's why you want to have a good therapist like us, right, Brad?
you better believe it.
All
So what can we say, Bob?
Brad, the final thing we can say is, remember, we can fix just about anything
Yep, except for
a broken heart.
But
See how
we'll-
the heart is broken,
there
Brad?
but we're working
We're
on
trying
it.
to
I
put it
just
together.
Put it back together, and there
Yeah.
you go. I think we fixed this one.
There we go.
We can do paper ones anyways.
Thanks.